So, Andy, you talked in your speech about the importance of whole-person care. Why do you think this hasn't happened, and why do you think it's so important?
I think it hasn't happened because when the NHS was set up, it had very separate structures for physical health, mental health, and then social care was separate again. It was the council. And because of that, we've had a system that's been unable to see the whole person. So if somebody has had serious mental health problems throughout their life, they may well have had their physical health needs neglected, because in mental health settings there isn't often the physical healthcare support. So that has to change, in my view, in a century when mental health problems are going to be a much bigger part of the challenge that we all see as society.
You say you want it to change, but do you think it's important that this change is done through cross-party talks? For not just Labour or Conservative, whichever happens to be in power, but all three, Labour, Conservative, Liberal Democrats, have to work together on this?
Well, if it's possible, but you know, sometimes it isn't possible. I fundamentally disagree with the Health and Social Care Act 2012 because I believe it will bring more privatisation, and indeed I think it puts the NHS on the wrong path for the future, and that path is a fast track to fragmentation, when actually the 21st century demands the opposite. It demands integration of services, the ability to see the whole person. So my argument to what the government has done is that if you go down this road where you competitive tender for all services, in the end you bring in an ever-increasing number of small providers onto the pitch, and that makes integration even harder to achieve, and we move away from a whole-person approach.
Yeah, so you'd like to see an integrated health and social care services rather than going towards the private, smaller providers providing individual bits of care?
Yeah, I think the 21st century demands that approach, because care is more complex in this century. People may have physical but also mental health problems at the same time, or older people may have very complex needs. Their needs may be a blur of physical, mental and social, and that means we need integrated teams of people, a range of professions working around the person to provide all of the support that that person needs. And if you have this kind of world where there's small providers all doing their own little thing, it just intensifies this frustration of people telling the same story to everybody who comes in the door, because nobody's kind of got one record, one coordinating role in respect of that one person's care.